本セミナーでは、トヨタ財団の
For today's online luncheon seminar, we invited representatives from two projects which are part of the Toyota Foundation's International Grant Program, Practitioners Exchange on Common Issues in Asia, and Special Subject Program, Migrants and Japanese Society, to listen to their respective efforts. We will receive comments from experts too. The discussion will focus on those accepted into Japan as nurses and caregivers, mainly from Asia, those accepted through EPA program, or those who have already returned.
に焦点を当てて議論を進めてまいります。
ニモンジャです。よろしくお願いいたします。
This is Nimonjia. Thank you very much for inviting me to speak. I am mainly engaged in education and support activities for foreign nursing and care workers in Japan. Last September, the Ministry of Health, Labor and Welfare announced that 34,000 foreign nationals are working in the medical and nursing fields in this country. It is said that there is a shortage of 200,000 to 300,000 caregivers. It is natural for us to develop human resources in our own, but we also need to introduce human resources from abroad. This is a diagram of the Regional Comprehensive Care System. In Japan, the so-called 2025 problem surrounding the elderly is just around the corner. This is a report of securing human resources for nursing care and establishing a virtuous cycle of quantity and quality toward 2025. But the report does not include foreign residents within this community-based care system. We should revisit this issue and need to figure out how to create a place for foreign caregivers. Nursing care is working in closed spaces with poor ventilation, crowded places with many people, and close contact setting, the so-called 3 Cs. The basis of elderly care is based on taking the close communication between people, which is a difficult task under COVID-19.
では、吉富さん、コメントをいただけますか？
Yoshitomi-san, could you give us a comment?
外国ルーツの人たちが
In the field where people with foreign roots work,
現場
as a caregiver, we can see the problems of our own society itself. There are many opportunities to improve or need to be improved. We seem to lack the idea of foreign people living in Japan for a long time could be recipients of care at care facilities as they age too. It would be great if foreign caregivers could play a more active role in various scenes at their workplace. In the 2000s, the Japanese government signed bilateral economic partnership agreements with Indonesia, the Philippines, and Vietnam. As a result, since 2008 until last year, about 6,000 nurses from these countries have come to Japan. They receive training to work as nurses or care workers and then study for the national examinations while working at hospitals and facilities in Japan. Due to the low pass rate of the national examinations and the low retention rate, some researchers and journalists have said that the acceptance of nurses and care workers under the EPA framework was a failure. However, I think it is premature and somewhat short-sighted to make such a judgment. I believe that these returnees who have studied the Japanese language for a certain period of time in an appropriate environment and have valuable experience working in the field of nursing and care in Japan for several years can become valuable human resources who can play an active role in many fields if they are connected beyond national borders. I say this because the entire Asian region is aging. We are aiming to create a network of EPA returnees. This year, EPA returnees and their instructor who live in different parts of the Philippines decided to hold study sessions using the Zoom, and they started holding sessions twice a week for half a day from August. Without COVID, this idea itself would never have been brought up. It makes it easy for people with children to participate too. The number of COVID infections and deaths is very high in the Philippines and Indonesia. There is still a lot of tension in the society. As for a project, I like to resume next year onwards, starting from where we can. We need to create an environment where people who come to Japan and people accepted by Japan can really learn in Japan. This is the responsibility of the receiving country. So we need to raise awareness of this. It is generally said that 70% of nurses and caregivers from overseas leave their jobs after 3 years in Japan. But as a matter of fact, one of our team members who works with foreign colleagues at a care facility told me the other day that her colleague who came to Japan with the Japan-Philippine EPA recently celebrated her 10 years of service and received an award at the workplace. I asked her why she was able to maintain there for 10 years. The reason given for one was making a living for her family. The other reason was that she enjoyed taking care of people. This feeling of nursing and caring is fun has motivated her to stay for 10 years. The staff turnover rate at the facility itself is low too. I think everything depends on how you manage motivation, salary, treatment, and additional benefits to continue working. Technically, I think experience of geriatric medicine or geriatric nursing, geriatric care, and elderly care are meaningful. In the near future, Asia will enter time of aging population, so people's experience here will be like a training opportunity and hands-on experiencing to think about how to manage the situation in their respective countries. I don't think there is anything wrong with being able to speak Japanese too fluent, so it is a good idea to continue to support them to improve their Japanese language skills. They may have trouble raising their children and return to their home countries. If schools can create an inclusive atmosphere and parents are at ease to send their children to schools, then parents can work and raise their children with peace of mind. So I think such support is necessary. Comprehensive community care is really part of town planning. Naturally, there are foreign nationals in the city. They make work in different jobs, be it housewives or be it children attending school. But how to incorporate them into the community is a very difficult task. The reason is that many Japanese people are socially isolated too. So, if we are interested in building another town or community, We need to be ready to include the foreigners who live as our neighbors.
というふうな気構えが必要なのかなと思います。
そろそろですね、時間
The
が近づいて
program
ま
is
いりまし
approaching
た
to
の
an
で、
end.
今日の
May I ask everybody for their last comment of the day?
日本に来るイン
It
セ
is
ンティブ
clear
って
that the incentive to come to Japan is becoming lower and lower.
特にベトナム
Especially in Vietnam,
いろんな国に
nurses and caregivers have many channels to various countries, and Japan is just one option for them. Therefore, I think it is important for us to approach people from Vietnam with the awareness that they have chosen us among the many options available to them. The management of companies that accept technical intern trainees has changed hands from fathers' generations to their children's generation, and the companies are rejuvenating. Younger management thinks differently from the previous generation. I think there is hope in that. As for the ideal or success of the EPA, if possible, I would like to see the data collected so that we can trace them even after they return home. Also, as for support after passing the exams, it would be good if supporters could stand closely with them, as they could be struggling with child rearing and career paths. I think that the aging of the foreign population in Japan will become an important issue in the future too. I feel that Japan is facing a variety of social issues, and people from other countries who arrive are being exposed to them. We need to create a society where we ourselves are happy, where we are aware of human rights, and where it is easy to live. Unless we aim for that, we will not be able to create a society where diverse people can live at ease.
それでは皆様、
I look forward to seeing you all again next time. Thank you very much for your time
ありがと
today.
うございました。